Hello, it's Josef de Pfeiffer, founder of Surgical Robotics Technology. I'm really excited to be joined today by Brian Cohen, orthopedic surgeon and founder of Cohen Orthopedic. Some of you may have seen Brian in the news recently because he just achieved quite a significant milestone of passing 2,000 Stryker robotic surgeries with the Mako system. And Brian and I connected shortly afterwards, and really pleased to have you be able to join us today, Brian.
Oh, very excited. I appreciate the opportunity.
Great. So I'd like to start by asking you 5 quickfire questions, and if I could please ask you to provide either a one-word answer or a short sentence. We'll then have time to discuss in more detail later on. Does that sound all right?
Yeah, I'll do my best.
Excellent. So the first question is, what is the number one patient benefit from robotic-assisted orthopedic surgery?
Accuracy in sizing and positioning.
Thank you. And the second question is, what is the number one factor that is slowing down the adoption or limiting the adoption of robotics in orthopedic surgery?
I think it's a combination of cost, and that's not how we usually do it.
Okay. And question number 3 is, what is the general perception, thoughts, concerns from patients of having a robotic-assisted surgery before the procedure?
Are you doing the procedure or is the robot?
Okay. And how do perceptions change after the procedure?
After the procedure, I don't think it changes at all. I think that, and there goes the one-word answer. But anyway, I just think that the fact that they do so well, I don't think they think about how it was done anymore.
Thank you. And question number 4 is, somewhere in the region of 11% of knee replacement surgeries in 2020 were performed with robotic assistance. What do you think that percentage will be in 5 years' time?
I think it'll probably be 30%.
Okay, so a pretty big improvement. And the final question from the quickfire round is, what new technology are you most excited about at the moment?
At the moment, I'm very excited about biologics in rotator cuff repairs.
Thank you. So let's jump into it. Could you start by providing a background to yourself and Cohen Orthopedics?
So I'm basically in practice 23, finishing my 23rd year. I trained at Mount Sinai Hospital in New York City, both med school and residency in orthopedics, and then did a fellowship in sports medicine. Cohen Orthopedics to me is more of a concept. I was employed for 22 years at one institution and was very much a part of the team. When I left there, I decided that there were some things that I wanted to focus on as an individual orthopedic surgeon. And Cohen Orthopedics is more of a concept of really trying to focus on putting my patients first and just being kind of a different type of physician where access is the key. So my patients have access to my cell phone number. They have access to me through social media, which I was not a part of prior to a few years ago. So I think it's more of, how can you deliver care like you're delivering it, like you would want it for your family member, your mom or your dad or your brother or your sister. So that's kind of what the focus is at Cohen Orthopedic.
And what are the main specialties you offer?
So I was fellowship trained in sports medicine, and in the United States, sports medicine has a very high focus not only on sports medicine, but also on shoulder replacement. I was very fortunate to train at Rush St. Luke's in Chicago, and one of my mentors, Dr. Anthony Romeo, is a world-renowned shoulder surgeon. So not only did we do a lot of sports medicine procedures like ACLs and knee scopes, but we also did a lot of shoulder procedures like rotator cuffs and instabilities, but as well as total shoulder replacements. So I offer basically, everything in sports medicine, everything in the shoulder. And then because of where I was located for most of my professional career, I had to do a lot of hip and knee replacements as well as revision surgery. So I do those as well.
Excellent. I saw a video on YouTube recently, actually, that you've just purchased some land.
Yes. So you can only do so much for an individual vision when you work for other people. Being towards the end of my career, my goal is to create a place that really focuses, like I said, on what I value. And not to say other people don't value it, but I really want to see how you can kind of push the limit on really making it the focus. So the patient being the focus, their safety being the focus, and also safety for your employees, and just making an environment where people enjoy coming to work. I think culture is important, and that's why you're successful when you have a group that's really focused on the same goal, working together. So we purchased 47 acres in Ross County, Ohio, and the goal is to build an ASC MOB facility and hopefully expand that to a new stadium for one of the ball teams in Chillicothe, Ohio, the Chillicothe Paints, and then some recreational fields and a community center for the community.
Wow.
Yeah.
And have you set a timeline on some of this stuff?
Well, I mean, our goal was to be in towards the end of next year. We're probably looking at the second quarter of 2025. Everything's kind of moving as they usually do. You have rules and regulations that you got to follow. It's not like a surgery approach where you identify the problem and you get the patient in the operating room and take care of the problem. You have to kind of dot the I's and cross the T's. But we're moving exactly in the direction we want to at a great pace.
Very exciting. And you mentioned earlier during the quickfire round that the main benefit for the patient is around the improved accuracy and precision. Could you please expand a bit on that and also talk about some of the other benefits that your patients see through your use of robotic-assisted surgery?
Sure. I think that, when I'm talking to my patients about robotic surgery, and we talk specifically in the knee, the computer is programmed off of a CT scan. And I explain to them that not only does the CT scan look at their knee, but it also looks at their hip and their ankle, so it gets their alignment. So we will be able to know exactly the angles that we're starting with in terms of their position of the knee. Are they varus? Are they valgus? And what are we going to correct them to? And also the sizing is based off of the bone structure. There's a safety component to the Mako as well. It has a cutting restriction that focuses on the patient's CT scan, so the bony cut, to avoid any inadvertent, what we would call plunging of the saw that could, go past the capsule and injure neurovascular structures. So there's a safety component. The other thing, when we do that manually, we have to figure out how to obtain the alignment. And sometimes we need to drill holes in the bone to put a rod up or down the tibia or the femur. And that obviously creates more blood loss because we're violating the canal, but it also can be painful for the patient. So I think, there is some degree of less surgical intervention when you come to what we're actually doing. And with the accuracy, I've been very fortunate that Stryker has developed the press fit technology to such a degree that, it's been a game changer. So, the fact that bones need to heal with close contact and good fixation, with the Mako doing the cuts, I feel like you get a more accurate cut that mimics the inner diameters specifically on the femur of the implant. So you get solid fixation, which obviously promotes good bone healing. Yeah, so I think I've gone away from cementation. My feeling is if we get good biological healing, then that bond potentially lasts forever, barring a significant accident. So there's no reason why, since the technology with the plastic has really come a long way in the last 20 plus years, to where we're not seeing the polywear that we used to see years ago. That replacements, if the patients respect them, can potentially last a lifetime.
Really interesting. And in a similar thread, you mentioned during the quickfire round that some of the biggest limitations or aspects which are slowing down adoption are we've always done it this way and cost. could you maybe expand a bit on this and talk a bit about how this can be addressed? Is it through more surgeon education?
Well, focusing on cost, the actual procedure doesn't cost the patient more or the insurance company more. A lot of providers or surgeons get preoperative scans to help plan their procedure. So to say that we get CAT scans for the procedure adds a cost, it does, but it's not. CAT scans are not as expensive as MRIs or some other things that we can do. But the actual procedure there's not an added cost to use the robotic technology. There is some added cost for some of the disposable sensors that we use, but it's not significant when you think of the benefits. So the cost is really by the institution. There's a capital cost that they just need to decide if we can take advantage of the positives from robotic surgery and market that and potentially see an increase in volume. Will that offset the cost? But the cost is not more expensive to the patient. And I think that's important when we talk about, one of the things I tell my patients is that adding the robotics doesn't add cost to your procedure. And in our experience, it doesn't even add time to your procedure. We've really gotten it down to where we've looked at, and this goes years back, where we looked at our first 50 and then our second 50, and it equaled what we were doing manually in terms of time from in the room and out of the room. And then as far as, this is not how we usually do it, I just think that there's a little, if you follow on some of the social media, specifically like LinkedIn, there's a lot of negativity towards robotics from the doctors who don't. And I don't understand why. If myself as a surgeon feel that I'm getting a better result for my patients with something, it doesn't have to be robotics, it could be anything. But if it gives my patients a better result and I'm doing less revisions and seeing less complications associated with it, why is that bad? And if you get great results with how you do it, that's great. We're not really in competition with each other. There's plenty of hip and knee replacement patients walking around everywhere, that there's plenty of business for everybody. Obviously, there's more business than there are doctors. So I don't know what the issue is or the hang up that some surgeons have with robotic technology. But like I said, if the way you do it gets great results for you and your patients, have at it.
That's a good view. So I think my next question is, there's various new systems entering the market there's various new systems at different stages of development, some entering the market. And as the systems continue to be launched and new systems enter the market and developed, what new features or developments would you like to see? I guess equally with the Mako, how could that be improved with future generations?
Yeah, I think, early on, one of the things we call it Mako limbo, because you have the infrared camera that has to see the sensors that we put in the patient's femur and tibia. So there's kind of this game of limbo where you're trying to retract to get exposure, but you're trying to see the sensors with the camera so that you're getting the information you need. And right when I started using the Mako, my question was, okay, how can we do this with a different type of sensor, whether it's Bluetooth or some other way to identify where things are in space and how they relate to the patient's CAT scan preoperatively, and try to, accomplish the same things with less invasiveness with the pins that we need to use right now, and also maybe not line of sight required. So that's one thing I'd like to see the Mako adopt, and I know they're working towards that. The other thing is, I've done a lot of revisions with the Mako. I think it also gives us a lot of information that we don't have, and I know they're working on the program that would be FDA approved, so I'm waiting for that and see how they adopt it. And then, obviously making things less cumbersome. I mean, the Mako robot's a big robot. Some of the other things that are out there that I'm sure you've seen, Think has the handheld mini bot. So how do we get those things to, kind of do the same thing with kind of less hardware and more software?
Great. And I know that one of your value propositions or one of your key messages is your commitment to using advanced or utilizing advanced technologies. Could you talk to me a bit more about some of the new technologies that you're using at the moment? Maybe outside of the robotic space.
Yeah, so I'm involved with Cohen Orthopedics, which is basically they have one product right now, which is a scaffold material. It's for rotator cuff repairs. It's basically made out of suture material. It's positioned between the tendon and the bone. And the research that we did early on with sheep, where we repaired rotator cuffs with and without the rhodium, which is the product. At 6 weeks, there was 34% increase in strength in the tendon to bone attachment with the rhodium than without. And at 12 weeks, there was 74% stronger attachment of the tendon to the bone with than without. And, the one thing about rotator cuff repairs and their re-tear rate, if we look at Doug Herman's study from 1991, we haven't changed our rate of re-tear. So we've done great with the instruments and how we do these things, but we haven't changed the biology. So the rhodium scaffold really has shown to basically change the way the body heals. And when we look at it under the electron microscope, we're actually seeing Sharpie fibers attached from the tendon to the bone. That's why it's much stronger attachment, where when we look at it without the rhodium, it's really a scar repair. So that's very exciting. And they just won the Navisor Award from the Shoulder and Elbow Society for Best Basic Science Paper for 2023. And then some of the human studies out there, specifically by Dr. Brian Badman out of Indiana, has shown that in his patients, a 7% re-tear rate with rhodium and a 50% re-tear rate without rhodium in patients who had rotator cuff repairs. So that's exciting for me. The other thing I like to focus on, is patient safety. In our new facility, our goal is to have the clean cube operating room. It's basically focused on patient safety. How do you decrease the risk of infection? Whether it's, glass walls with copper impregnation to decrease bacterial growth and make it bactericidal. It has a in-room dry hydrogen peroxide that kills viruses and bacteria and allows people to work in that environment. And then if you have a infected case and you want to terminally clean the room, it has a vaporized hydrogen peroxide, which has a 6-fold kill rate for bacteria and other viruses. And that they have to hermetically seal the room and basically fumigate the room in between cases. It takes about an hour to fumigate and evacuate the gas. So those are the things I'm looking on. The other is how do you make the patient experience and their caregivers' experience in the surgical setting better. And OsbyTech is another company that basically monitors the patient's journey from when they check in to when they go into the holding area to when they go to the operating room to when they come out of the operating room to recovery. And it basically keeps the family aware of what's going on. It keeps the surgical team aware, so everybody knows where the patient is in their journey. And the more information, the better. One of the things that we get, I guess, chastised about is that, you didn't communicate, you didn't come talk to me. Obviously the patient's waking up from anesthesia, they may not remember. Their family member may not be there when you're ready to talk to them and you're going into your next case. So this is a way to keep that line of communication open. And it's been very successful. It's based out of California in San Diego. And about 3 years ago, they had about 15 sites in San Diego. Now I think they're upwards of 50 sites around the country and growing. So, these are things that focus on patient safety, patient kind of awareness, and keeping their family up to date as well.
Thank you. And I think there's various companies and technologies that you've been involved in and you're sort of helping support. What does that process typically look like? Is it mostly an advisory role? Yeah, could you talk a bit about that?
Yeah, first of all, it has to be something that I'm passionate about. So obviously, if it focuses on the patient, whether it's how do we do things better or how do we make the experience better or safer, that really that helps me kind of get focused on it. You know, sometimes it'll be advisory. Sometimes, you know, like with the Mako, I don't have any relationship with Stryker, but obviously, you know, I'm very open about how happy I am with the technology and the Mako and the results that we're seeing. So, you know, as long as it benefits my patients, it's something that I can get behind.
Great. Actually, how do you hear about all these new technologies?
You know, it's usually, I think most of the time it's more of a cold call. And, you know, a lot of time it happens on LinkedIn. Somebody will just say, hey, you know, this is what we're doing. You know, it seems to, you know, kind of match up with what you're focused on. You know, you want to spend 5 minutes on a call. You know, kind of like when you guys reached out. I mean, you know, the fact that I put something on LinkedIn and you guys kind of shared it, you know, I mean, that was very kind of, you know, it's very rewarding for me. But also, I'm interested in what's going on in robotics, you know, in not only orthopedics, but other areas, just to see what people are doing. So obviously, this is one way to kind of stay on top of that.
Yeah, we had some really great engagement on your post. I hope you saw that. So yeah, I think my final question is, you know, what does the next 12 months look like for Cohen Orthopedics?
The next 12 months, we're going to be moving some dirt. So we're going to start, you know, the land is farmland, so it needs an infrastructure. So we'll be putting in the sewers and the streets and the gas lines and stuff like that. And then we'll be building up, putting some steel. So, you know, I think the focus is to, you know, finalize the different things that need to go into approvals and planning, start the construction, and then really grow out our team. You know, there's a lot of excitement around this, not only in, you know, my group, but also in the area. The community is very excited to have an option and to have it local. And, you know, I think that, you know, you spend a long time in a community, people start to understand who you are and what you're about. And being focused on patient safety and also giving back to the community, I think has resonated well. And, you know, I'm not doing it for anybody specifically. I'm just doing it because it feels right and it's what I want to do.
Yeah, you've got some, you know, really exciting stuff going on at the moment. I'll definitely keep a keen eye on it over the next 12 months.
No, I look forward to, you know, spending more time with you in the future and, you know, hopefully one day meeting up in person. But, you know, I really appreciate this opportunity. I like to share my story and I like to speak to people who are interested.
But yeah, thanks so much for freeing up some time to talk to me today. It's been great speaking with you. Thank you.
Thank you.